Hello, and welcome back to the channel. It's your public health safe space, and today we're tackling another topic. It's a beautiful day, it's getting warmer, so I implore you to get outside, have a walk, see the views. For now, we are going to talk about something that most people seem to push to the side. Today we are discussing STDs and STIs. You'll be surprised what we're talking about. So stay tuned for the discussion. Remember, like, comment, share, and subscribe. Let's go. It's a wonderful day. Can you tell? It's a windy day, but it's definitely a beautiful one. Can we tell? Wow, nature is something else. Now let's start our discussion. What if I told you that some of the most dangerous sexually transmitted infections are not always the ones people fear the most? No. Not because they are rare, not because they are dramatic, but because they are quiet. They do not always come with a warning label. They do not always announce themselves with pain. They do not always leave behind a symptom that forces you into a doctor's office. Sometimes they do something much more dangerous. They let you believe nothing is wrong. And from a public health perspective, that silence is where the real danger begins. Because when people assume they are fine, they keep living, they keep loving, they keep trusting, they keep taking chances, and they keep spreading infections they may not even know they have. Today, we are talking about 3 of the most dangerous silent STDs and STIs no one talks about enough. Not because they are the only ones that matter, but because they are some of the ones people dismiss, or misunderstand the most. And so it is important that we address these to improve advocacy and awareness. And before we finish, I also want to update you on something else that has changed dramatically in the last 20 years. HIV. Because HIV treatment has evolved. Prevention has evolved, medication has evolved, but human behavior, human risk, human assumption, that part is still trying to catch up. This video is not about shame. This video is not about fear for fear's sake. This is about awareness, protection, and knowing enough to make decisions that could protect your future health. So, if you have ever said, I would know if I had something. If my partner looked healthy, then I'm probably okay. Or if you said, if I felt fine, I didn't think I needed testing, stay with me. Because that assumption may be the most dangerous thing in this entire conversation. And the first infection on this list is the one that many people never even heard of. Most people haven't heard of it, which may be exactly why it deserves our attention. The name of this one, we're going to talk about Mycoplasma genitalium, or Mgen. That's how we'll refer to it going forward. So let's begin with the one that makes people stop and say, wait, what is that? I'm sure you said that when I pronounced the name. It's called Mycoplasma genitalium, often shortened to Mgen. And if you have never heard of it before, that is not unusual. But from a public health standpoint, it should concern you that an STI can be common, transmittable, and capable of causing real complications while still living mostly outside everyday public conversation. What is it? Mgen is a sexually transmitted infection that can infect the cervix, the urethra, and the rectum, as noted by the CDC. Why is it dangerous? Because one of the most important facts about Mgen is this: A lot of people with it do not know they have it. That is the phase, that is the phrase I want you to hold on to throughout this entire video. Possible symptoms in women may include unusual vaginal discharge, burning with urination, pelvic discomfort, irritation in the reproductive tract. Now we're also going to look at the possible symptoms for men because they should not be left out of the conversation. This includes burning with urination. Yes, burning with urination. I know other STDs carry that same symptom. Unusual discharge, irritation inside the urethra. Now, here's the problem. You can have Mgen and not feel dramatic symptoms at all. And that matters because infections that stay quiet often get more time to move through relationships and through communities before anyone even thinks to ask for testing. Why public health cares? Mgen has also become more concerning because it can be harder to treat in some cases, and antibiotic resistance has become part of the conversation around it. That means this is not just a random infection people can afford to shrug off casually. Now, there's a myth that I'm going to address, and it is this. If it was important, I would have heard about it. No. Some of the most consequential health issues are not the loudest ones. Some are simply the least discussed. And this is true. Now, the realistic question we should be asking is, would a regular STD panel always include this? Not necessarily. And that is exactly why it is important to ask questions instead of assuming everything has been checked automatically. If you have symptoms, or if a partner has symptoms, or if something feels off, it is okay to say, I want to know exactly what I'm being tested for. Yes, that is not overreacting. That is adult health literacy. Now, if Mgen is the infection many people have never heard of, the next one is the infection many people have heard of and still completely underestimate. This one is Trichomoniasis, often called Trich. This is one of the most overlooked infections in sexual health conversations, and honestly, it has been disrespected by public awareness for far too long. Because people tend to think if it's common, it must not be that serious. That is not how public health works, and that is not the thinking that I want you to have. Now, what it is Trich is a very common treatable STI caused by a parasite. And according to the CDC, most people who have Trich do not have symptoms. That is one of the most important things to understand, is that there may not be symptoms. Possible symptoms in women can include, but are not limited to, unusual discharge, vaginal odor, itching, irritation, discomfort during sex, and that is a big one to look for. Many people tend to blow off discomfort as something else, as well as burning with urination. Possible symptoms in men can include irritation inside the penis, burning after urination or ejaculation, and mild discharge. And again, for many people, there may be little to nothing obvious at all. Please remember that. Why it matters more than people think is Trich is not just a temporary inconvenience. It matters because untreated infections can still affect reproductive and sexual health, and broader STI guidance notes that untreated STIs can contribute to complications, including reproductive issues and increased HIV risks. Now, another myth, let's tackle this one. If I had an STD, I would definitely feel it. No, and I want that to sit with you. If you have one, you don't have to always feel it. Because a lot of people are building their sexual health decisions on how they feel rather than what they know. And those are not the same things. The realistic question here is, what if the symptom came and went? That does not mean it never mattered. Some symptoms are generally and can be mild, inconsistent, easy to dismiss, or mistaken for something else. And that is one of the ways silent infections win. Now, we get to the one people talk about all the time, but almost never talk about it correctly. So we are going to address it. The third STD we're taking into the conversation is genital herpes. And I need to say this carefully because this is where a lot of the public conversation goes wrong. People talk about herpes with jokes, shame, stereotypes, fear, and misinformation. But they do not talk about it enough in a mature, medically useful way. And that is what we are going to do today. We're taking it from a medical perspective. And that silence creates confusion. Here is what matters most. Many people with genital herpes do not know they actually have it. The CDC notes that symptoms can be very mild or not recognized at all. And many people may mistake outbreaks for razor bumps, ingrown hairs. Yes, I did say razor bumps and I did say ingrown hairs, irritation, or just saying just a little rash or something they assume will pass. Now, the possible symptoms may include one or more blisters, painful sores, tingling or itching, pain during urination, or flu-like symptoms during that first outbreak. So you've got it, and your first outbreak, you feel like you're having the flu. Please still pay attention to that. But in some people, symptoms may be so mild that they are missed entirely. Why this matters? Herpes is not just a social stigma issue. It is a public health communication issue. Because if people think they would definitely know, they are most likely to skip conversations, skip testing conversations, which is even more important, ignore symptoms, or unwillingly expose others. The myth here that we'll discuss is, I would know if I had herpes. That's the myth, and that's something that I want us to put aside. The truth is, you don't always know. The one myth alone has probably delayed more honest sexual health conversations than people realize. The realistic question then becomes, the realistic question then becomes, if I don't have sores right now, does that mean I can't spread it? Not necessarily. Herpes can sometimes be spread even when a person is not having an obvious outbreak, which is why informed conversations and good medical guidance matter so much. Always a dog barking on our conversations. On our walks, there's always a dog. Now let's continue. The important nuance here is if someone is having genital symptoms, the CDC says testing can help confirm what is going on. But CDC does not recommend routine herpes blood testing for everyone without symptoms in most situations because those tests have limitations and can sometimes be misleading. So we're not telling you not to test. We're just saying once you notice these symptoms, it is important to test. That is important because this is where the video becomes different from panic content. I'm not telling people to spiral. I'm telling you to get informed care. That's what the goal is. That's what we're trying to do, inform you. Now, there are some lies that people still believe about STDs, and we're going to step into that portion of the conversation. Now, let's pause right here and talk about something bigger. Because the real problem is not just the infections, it is also the beliefs people carry in their bedrooms, their relationships, and their medical decisions. And you know what I'm talking about. A lot of times we fail to get out of those old ways and old thought process when it comes to our health. The lies people still believe about STD, and we're going to cover maybe 4 or 5 of them. The first one, no symptoms means no infection. That is false. Lie number 2, if my partner looked healthy, I'm probably safe. That is not a medical assessment. That, my friend, is a guess, and we cannot guess about our health care. 3, if it went away, it wasn't serious. That, again, is false. We do not want you to have that thought process. 4, only certain kinds of people get STDs. That kind of thinking is exactly why people delay testing. STDs, STIs are not a character flaw. They are a health issue. Now, the final one, as long as HIV medication exists, people don't have to be as careful anymore. And this is where we need to have a more grown-up conversation because of statements like this. Now, I'm going to give you some HIV update. So let's get into it. Let's talk about HIV. Not as fear bait and not as stigma, but as a public health update. Because the HIV conversation today is not the same as it was 20 years ago. And that is a good thing. You ask yourself, what has changed? Treatment has changed dramatically. Today, HIV can be treated with modern medication, and the CDC states that when someone with HIV takes treatment as prescribed and reaches an undetectable viral load, they do not sexually transmit HIV to partners. So that is the basis of U equals U. A lot of people may have heard of that phrase, U equals U, which is undetectable equals untransmittable. That is one of the most important public health advancements of our time. But here is the part people need to hear clearly. Better treatment does not mean zero risk behavior is suddenly wise. No, we don't want you to encounter or think, oh, I could do whatever I need to do. And better HIV prevention tools do not mean people should become casual about the rest of their sexual health. Why this matters now? Because some people have mentally translated there's new medication or there's medication now into I don't have to be careful, and that is not how this works. There are powerful prevention tools now, including, and I'm going to list them. Condoms, of course, everybody knows about that. PrEP, PrEP. This is medicine taken to reduce the chance of getting HIV. And PEP, that's PEP, which is emergency medication after a possible exposure, which must be started within 72 hours. So if you notice, I was clear to point out PrEP versus PEP, one with an R, one without. But, and this is critical, PrEP with the R is highly effective for HIV prevention when taken as prescribed, but it does not protect against other STIs. Let me say this again, it does not protect against other STIs like herpes, Trich, gonorrhea, chlamydia, or Mgen. That means someone can be protected from HIV and still be at risk for everything else we have discussed. What should people look for? That is important. Do not wait for proof before you take your health seriously. What to pay attention to? Burning with urination, unusual sores, genital irritation, unusual discharge, bleeding between periods, pelvic pain, symptoms in your partner. Yes, you can look for symptoms in your partner as well, or even no symptoms, but a recent exposure or unprotected encounter. What should you do? What should be done? If there was a recent possible HIV exposure, talk to a provider, urgent care or ER immediately, because PEP must be started within 72 hours. If you are sexually active and have ongoing risk, and whether PrEP makes sense to you or not, if you are sexually active in general, this is important. Normalize testing, normalize conversations, normalize not gambling your health on assumptions. And let me say this clearly for you to understand. This is not about stigmatizing people with HIV. No. This is about updating the public. Because a lot has changed medically. But safety still matters, honesty still matters, testing still matters, and assumptions still cost people. I've made sure to go through this slowly. Giving you the information, I'm going slower than I usually do, because I want you to understand the importance and I want you to get the message clearly. So let's end where public health should always end. Not with shame, not with panic, not with judgment, but with action. Because if you have watched this far, then you now understand something many people still do not. Feeling okay is not the same thing as being okay. And silence is not always safety. So if you have symptoms, you have been ignoring, let me say, if you are ignoring some symptoms, a partner with symptoms, a recent sexual encounter you have not followed up on, it is important that we follow up on these. It's very important to follow up on these symptoms. Now, I want you to be honest with yourself, because this is an honest conversation I'm having with you, and I need you to be honest with yourself. If there's a possibility of a testing history to build on, I don't want you saying, oh, I'm just assuming that I'm fine. No, we want to get tested. Then if you are having that mindset, let this conversation be your interruption. Not your embarrassment, not your punishment, your interruption. A moment where you stop saying, I'll deal with it later, and start saying, I need to know. Because the truth is, Some of the most dangerous STDs are not the ones people fear the most. They are the ones people leave untested, untalked about, and unquestioned. And if this video does anything for you today, I hope it does these things. I hope it makes you more conscious, more careful, more informed, more honest with yourself, and more willing to protect a body you are going to live in for the rest of your life. This is not about being paranoid. This is about being prepared. And in public health, preparation saves people every single day. If you are sexually active, STI testing is one of the most important things you can do to protect your health. Please, I'm imploring you. And the CDC says everyone ages 13 to 64 should be tested for HIV at least once, with more frequent testing depending on your risk. So if this raised questions for you, good. Now take the next step. Call the doctor, book the clinic appointment, ask the question, and get tested. Because not knowing may feel easier in the moment, but knowing is how we protect our future. And that is what I'm trying to do for you. I'm advocating for you so that you're able to protect your future. You're able to make the sensible decisions, live a long and healthier life. Thank you for being here. It was a pleasure talking with you. And as always, your perspective has increased, your knowledge has increased, and I'll return with another conversation. Like, comment, and subscribe. Enjoy the rest of your beautiful day. Life is happening. Can you hear the sounds? People are doing what they do, and we are doing what we do, advocating. Enjoy your day.